Hi. Yes, sir. Now in this video we will discuss some more 5 marks very important questions of your medicinal chemistry, and this will be our last video of medicinal chemistry. Okay, we have completed all the medicinal chemistry very important questions of 10 marks and also 5 marks. So if you are new to this channel, first subscribe, then you go and watch the playlist of this. I will make a playlist and add in the description. Go there, and most of the questions what asked in the 5 marks, no, that questions repeatedly asked here. Okay, most of the questions what we studied, no, in 10 marks question and answers, part 1, part 2, part 3, part 4, that 10 marks questions they have asked in the 5 marks here many times, many questions they were asked. So my request to you all, so first you go and watch all the 10 marks session, so that you can easily know that. Okay, it's my request. Without going to those 10 marks, you are unable to practice these 5 marks. It is very much difficult for you. So please go and first watch all the 10 marks. Take a time, okay, because now only you are having a time. After remaining 15 to 20 days in the examination, no time. Okay, if anyone asks at that time, sir, please tell me how to pass, means see, I am helpless there. So please you practice. So now having time, you are having time now, you practice now. Very simple questions are there, just you have to practice the structures. And next inshallah we will discuss about the pharmacology. Okay, next from next classes, upcoming classes, we will discuss 10 marks very important questions with answers of a pharmacology. See here, now in 5 marks our next question is 8th question. Write the structure of atropine, discuss its mechanism of action, uses and side effects. Very simple. First you have to write what is this atropine. See, it is an anticholinergic agent used to decrease the saliva production, slow heart rate, maintenance. See, most probably in the Parkinson patient, what happens, they are having the excessive production of the saliva. So to decrease that saliva production, what we are giving, this type of atropine drugs we are giving. And it is an alkaloid, and it is also means it is given intravenously, most probably into the IV or IM route. Structure of this is the structure of the atropine. I will upload the notes in the description. You can go and watch there. See, very simple structure. One square type box is there. 2 boxes are there. Then that is attached to the one benzene ring. Okay, one C double bond of ketone group. Next properties, it is obtained from belladonna. You know that belladonna plaster. Hansaplast, what is available in the market? No, belladonna pattu. It occurs as a colorless white crystalline powder, very soluble, means it is soluble in water. Efflorescence in dry air, it will evaporate, and it should kept in well closed container and protected from light. Yes, it is readily absorbed by gastrointestinal tract and excreted in urine partially as a metabolite. I have told you metabolite means what? See, first one, what? The drug. If the drug, if it passes phase 1, then what happens? The drug changes to the metabolite. Metabolism and metabolite difference. See, the drug, initial drug, when changes to the final drug, that is known as metabolite. Mechanism of action. Atropine has both central and peripheral action, means central and peripheral. It acts both as a central nervous system and a peripheral nervous system. It first stimulates, then it depresses the control nervous system. It has antispasmodic action on smooth muscle. Means if you are having stomach pain, means it acts as an antispasmodic. You are observing that menstrual pain, periodic pain, this atropine, by giving this atropine, what happens? This will relaxes that pain. Okay, smooth muscle pain. Then it increases the tone of muscle, smooth muscle, and diminishes the gastric and intestinal motility. Then uses, it is used in the treatment of gastric and duodenal ulcers. For treatment of the ulcers we are giving this. Then smooth muscle spasm means because it is act as an antispasmodic. Then it is a symptomatic treatment of Parkinson and used to depress the CNS. Yes, it is used to reduce the bronchial and salivary secretion before the induction of the general anesthesia. Side effects, see, eye irritation, redness, swelling, dry mouth, red or dry skin, blurred vision, sensitivity to bright light. See, for most of the drugs you will get the maximum 4 to 5 same side effects, like dry mouth, dizziness, nausea, vomiting, blurred vision, red or dry skin, or irritation on the skin. These are common in all the side effects of the drugs. Then write the synthesis of the dicyclomine hydrochloride, mechanism of action, uses and side effect. This question also asked in your question paper. You can go and check that medicinal chemistry previous year question paper. First you have to write the structure of this dicyclomine. Then it is anticholinergic agent. It is act and antispasmodic. It relieves muscle spasms in the gastrointestinal tract by blocking the activity of a certain natural substance in the body. Properties: it is white crystalline. It is soluble in water. Then see, this is the synthesis of the which one? Dicyclomine hydrochloride. Dicyclomine hydrochloride means, see, in dicyclomine mephtalspas, then cyclopam, that all tablets contain this dicyclomine hydrochloride. In cyclopam, dicyclomine hydrochloride plus paracetamol, but in mephtalspas, mefenamic acid plus dicyclomine hydrochloride. Here both are NSAID only, okay, non-steroidal anti-inflammatory drug. See, synthesizes. This is the synthesizes. Bromine with the cyanide forms one intermediate. That intermediate on reaction with the chlorine with some complex substance, the formation of dicyclomine hydrochloride. Mechanism: it acts on a non-selective smooth muscle relaxant, means it has a specific anticholinergic effect at muscarinic receptors and has a direct effect on smooth muscle. See, muscarinic receptors and nicotinic receptors. Two types of receptor. There's very simple. What are these muscarinic receptors? See, now on your blood vessels, on your muscles, these are the receptors. Now this is the drug. These drugs will be settled in the muscarinic receptors. Muscarinic receptors. These muscarinic receptors, what they will do? They will send the action of these drugs through the circulatory system throughout the body. Okay, by that way the action takes place. Simple. Main function of this muscarinic receptors is to collect the drug. After collection of the drug, what happens? The work of the drug, it shows itself only. Clear? Then uses: it relieves the muscle spasms. It also used to adjust in the treatment of gastric and duodenal ulcers. It used to relieve periodic pain. Side effects: same, dry mouth, upset stomach, vomiting, constipation, stomach pain, gas or bloating, dizziness, loss of appetite, rashes on the skin. Okay, see. Next question, our sixth question. Write the structure and uses and side effects of indomethacin, ketorolac and naproxen. Three drugs what we have given here, no? Three drugs. These all are the NSAID. Indomethacin, it is a NSAID used to treat the moderate to mild pain. See, structure of this is indomethacin structure. It is used to relieve pain, swelling, joint stiffness, used in arthritis, used with other pain reducers. Then side effects: upset stomach, heartburn, headache and dizziness. These are the some common side effects. Then we discuss about the some of the next one, ketorolac. Ketorolac, it is a non-steroidal anti-inflammatory drug used to treat the pain. Structure: this is the structure of the ketorolac. Uses: used for the short-term treatment of moderate to severe pain in adults, used to decrease swelling, used to reduce the fever. Then also it is used in the pain. Which pain? Tooth pain. Okay, if tooth pain or this dental pain, no, at that time we are giving this ketorolac. Side effects: upset stomach, nausea, vomiting, constipation, diarrhea, gas, dizziness. For most of the questions, side effects are same here. Maximum, same side effects. Our next, the last C, that is a naproxen. It is also a NSAID used to relieve pain, headache, then atchis, dental pain, menstrual cramps, swelling and joint pain. Side effects: same, upset stomach, nausea, vomiting, dizziness, drowsiness. Okay, these are the some of the side effects of the naproxen. Next, our last question of the medicinal chemistry. Write the synthesis of the proclinidine hydrochloride and its mechanism of action, uses and side effects. See here, one more point I want to tell you before going through this question. See, you are observing, you are, sir, only 7 questions in 5 marks. Sir, there are many questions now. Why you are giving only 7? See here, if you practice the 10 marks questions now, in that 10 marks only you will get here. I will tell you for an example. What are indirect acting spasmomimetic agents, structure and uses of any one drug? There we discuss indirect acting. 3 types we discuss now. What is a sympatomimetic, direct, indirect? 2 types we discussed. There only we have completed indirect. No, then why again here? Then phase 1, phase 2 we completed in previous our lecture. Go and watch that. One more very important, bioisoterism, optical, geometrical. Okay, that all comes under the then phase 1 biotransformation, role of solubility and protein binding. Initial classes we have I have told you, see that I will make unit wise notes, I will make unit wise lectures, so attend that classes. At that time I have told, no, there I have uploaded there. Okay, that only I am telling, my dear brothers and sisters. First you go and watch all the series of this medicinal chemistry. If you watch all the series of my medicinal chemistry, means you are hero here in the medicinal chemistry, and you will get a good marks, very good marks in the medicinal chemistry. Very repeated questions is there, so please try to write the concept here. Structure of the proclinidine hydrochloride. It is an anticholinergic drug, principal used for the treatment of drug-induced Parkinsonism and other diseases. See, this is the structure of proclinidine hydrochloride. Mechanism of action. See, proclinidine hydrochloride acts by blocking central cholinergic receptors and thus balancing cholinergic and dopaminergic activity in the basal ganglia. Very simple. What it will do? It will block the cholinergic agents. It will block the cholinergic nerves, receptors, and it will balance the dopamine and cholinergic in the where the activity took place in the basal ganglia. But the mechanism of action is clearly unknown here. Partially we know, but clearly it is unknown. Synthesize acetophenone made to react with the formaldehyde, formation of 2,4,5 tetrahydropyrrolidine, then managed condensation, formation of the one more complex structure, pyrrolidino propionone. Then the last structure is proclinidine hydrochloride. You have to practice these structures. I will upload the notes, you don't worry, just practice. Yes, next one is uses used to decrease muscle stiffness, used to reduce sweating, used for the production of the saliva, means reduce the saliva production in Parkinson disease, improve walking ability in Parkinson disease patient. Side effect: drowsiness, dizziness, constipation, nausea, blurred vision, dry mouth, and nervousness. These are all the side effects here. Okay, last but not the least point from my side is the basic point here: practice these structures. Once you practice 2 times, 3 times, at 4 times, when you are practicing, when you are writing, no, definitely you will get this structure. So my request to you all to practice these structures, and I will upload the notes in the description. So if you like this video, comment me, tell me how is my video, is it helpful for you, okay, or any changes I had to make. So please write down in the comment section. Then one more thing, the next classes we will discuss on the pharmacology, very important one. Why I took the pharmacology means because pharmacology and medicinal chemistry both having relation here. Now if you are hero in medicinal chemistry means then definitely you will be double hero in the pharmacology. Next we will discuss inshallah about the physical pharmaceutics too. Okay, for now you subscribe my channel. Let's Join Pharmacy. Thank you.